Hi, thanks for watching this video today. In this video I'm going to be talking about fat transfer to the butt as well as the breast, and how we perform the procedure, what the limitations are, and what the potential expectations are. Now, how we perform it. So the fat transfer is essentially we're taking fat from one area where you don't want it and placing it in another area where you do want it, in this case the breast or the butt. So as far as collecting the fat, we do this through liposuction, and you can watch one of our other videos to explain how that is done. But essentially we're going to take the fat from an area where you don't want it. But with the fat transfer, we do this in a slightly different manner. The instrumentations that we use are a little bit different, and when we collect it in such a way that it's more protecting to the fat. So we put less stress on the fat to hopefully have an increased number of viable fat cells. The container that we collect the fat in for the fat transfer is a sterile system. And it's a closed system, which means that the fat itself is never exposed to the air. So it goes directly from your body through the tubing into the canister, which is a sterile canister. Through that canister, we're able to separate the quality fat cells from the fluids, the dead fat cells, as well as the oils. And now we are left with only the quality fat cells that we want to transfer back. We're able to siphon that fat directly into our instrumentation and inject it back into the butt or the breast. What this does is it completely eliminates the exposure to the air, which would give you potential risk for infection. So using a system like this would significantly reduce the risk of infection. So once we've taken the fat out, we can inject it back into the butt. Now the butt is first going to be numbed similarly to how we numb the area with liposuction. We're going to use a tumescent fluid. The fluid is injected into the butt or the breast to get the area numb. So the process of injecting the fat back into the area is essentially painless. Now, there are some limitations as far as the fat transfer. Now you have to think of this as we're transferring the fat, but it's not all the fat's going to survive. It's almost as if we are planting seeds in the garden. And just like planting seeds in the garden, you can't just put the seeds out and expect them to grow and flourish. You have to water it and make sure it gets proper sunlight and make sure you have the right soil and you take care of it. Well, with the fat transfer, it's the same way. We're going to put the fat into the butt or the breast, and you have to take care of it. You have to do the right things to get the best results and allow the body to accept the fat and nourish it. And in nourishing the fat, what that means is that the body needs to create a new blood flow to get to bring the nutrients and the oxygen to the fat to help it survive. Now, the limitations that we have is that we don't want you to put pressure on the area, and the pressure on the area is limited to the first 2 weeks we want no pressure, and for the first 2 months we want limited pressure. And the reason behind this is simply that because we want to create this blood flow, if you put pressure on the area, it collapses the blood vessels and the blood can't get to the area. So it's essentially choking the fat, and the fat can't get the oxygen or the nutrients that it needs to survive. And if it doesn't get its nutrients, doesn't get its oxygen, you'll have less results and more fat loss. Now, there are limitations on the size that we can go on the butt, or the breast for that matter. The limitations are essentially going to be based on the individual. Some people have looser skin and more space to fill, in which case we can go larger, and some people have much tighter skin and less space, in which we are limited on the size that we can go. All the studies show that approximately 50 to 60% of the fat that we inject will actually survive. And because we know this, we're going to over-inject to give you more fat than you need or that you want, in the anticipation that you're going to lose about 40% of the fat. So the hope is after the loss, you'll be left with what you want. As far as restrictions to your diet, you want to think of this as you're putting your body in the state of accepting fat cells. You want the fat to survive on the butt or the breast so you can get the best results. So if you're trying to tell your body that you want to lose weight through dieting or exercise, you are going to get less fat to survive on the butt or the breast. You have to put it in the state of mind of accepting fat cells. Now, I'm not saying go out and eat fast food and ice cream at every meal. No, just don't lose weight. So don't diet trying to lose weight. Don't exercise trying to lose weight. And by exercise, I mean don't go on the treadmill, don't go on the stair stepper, don't go on the elliptical, the things that you would be sweating profusely, you want to avoid. Now, you can still work out, just don't do those things that you would be sweating. So you can do strength training, lifting weights, things of that nature that are going to get you stronger but not necessarily burning those fat calories. Now, as far as the expectations with this procedure, and I kind of discussed this a little bit earlier, in that we anticipate that 50 to 60% of the fat cells that we transfer will survive. And with that said, that means about 40% will not survive. So you have to be realistic in that there's only so big we can go. Because again, with the limitations of the skin, it's only going to stretch so far. And once it gets to its maximum point of stretching, it's going to push back so hard, and the fat's just going to kind of ooze back out. So as far as how much of an increase you can expect, the studies show that with the breasts, women are getting about 1 cup size increase. With that said, we have had some that have gotten 2 cup size increases. Some that have gotten slightly less than a cup size increase. It's all going to vary from person to person, but on average you would expect about a 1 cup size increase in the breasts. Now, the other advantage with the breasts is just because it's 1 cup size, we are also able to fill into the upper area of the chest, where a lot of women have lost volume, and also as well as into the cleavage area. Again, where you've lost volume. Typically, after women have had children, their breasts tend to sag, and you get lack of volume up here and droopy breasts down here. And a lack of volume, and the women get these, they call them pancake breasts. These are perfect candidate for fat transfer. So we can inject fat into the upper pole of the breast so it appears that the breasts are sitting up higher. And then when you wear a push-up bra, you just have a lot more to work with, and you get more of that cleavage, and the breasts appear to be sitting up higher on the chest. In regards to the butt, you're going to get about a 25 to 30% increase in the butt on average. And the nice thing that with the fat transfer is, again, we can fill in spaces of voids. A lot of women or men will have voids on the side of their butt, so we can fill it in to give you a more round shape to the butt. Now, there's always this question, where do you take the fat from? So, because we don't want to put pressure on the area, with fat transfer, it's going to somewhat limit the areas where we decide to take the fat from. For example, if you want to do fat transfer to the butt, we wouldn't suggest taking fat from the legs, because the garment for the legs puts pressure on the butt. So to get the best results for the fat transfer to the butt, I do recommend taking fat from the waistline, because you want to get a smaller waist and a bigger butt. Smaller waist, bigger butt, the contrast is what people find attractive. For the breasts, again, the abdomen is always a good place to take it. You can also take it from the legs as well. A little bit less of a concern, but with the butt, you really want to take the fat from the area that's distracting away from the butt. Typically the waistline, the hips, the butts will tend to blend right into this, and it distracts away from what the natural look of the butt is. So we want to take that away, define where the butt is, so we can define the upper portion of the butt, and take away all the bad stuff in the waist.